Thanks for tuning in to our virtual conference. I'm Pam Bauer, Vice Chair on the board of the MSA Coalition. Today I want to share some exciting late-breaking news about our research program. The MSA Coalition remains committed to finding effective treatments or a cure for MSA. We believe that funding research is funding hope. The Board of Directors voted this week to finalize their selection of the top research projects as recommended by our scientific advisors. I'm thrilled to announce today that this year over $500,000 will be awarded to global researchers. I'll share more about the individual awardees and their exciting work in just a moment. Since establishing a research grant program in 2013, each year, the MSA Coalition have invited global researchers to send in their best ideas for MSA research projects. The response has just been simply overwhelming. In less than 10 years, our program has grown to include more than 50 research projects at 35 centers in 12 countries, an investment of more than $2.5 million. We are proud of this work that has made an impact on the research field and resulted in over 50 published articles, which are now a resource for other researchers to build on. To ensure the best projects are selected in a fair and unbiased manner, our scientific advisory board carefully consider every research funding application to make sure it meets a high standard of excellence and fills a critical need for multiple system atrophy. Our research program follows the principles of the Global MSA Research Roadmap, a document published in the journal Neurology in 2018. The MSA Coalition played a key role in drafting this document with input from the patient community. It describes the need for increased funding support for 4 types of research projects that will increase scientific knowledge about MSA and lead to better treatments and one day a cure. Pathogenesis projects are needed to help understand the underlying cause of MSA. Biomarker studies can lead to the development of improved diagnostic tests. Preclinical projects involve critical lab studies using cell or animal models of MSA. Clinical studies enable patients to get directly involved by trying out a new intervention, donating blood or other biospecimens, or sharing data about their experience with the disease. Each of these 4 project types provide evidence to assist government bodies like the FDA to make decisions about whether a potential therapy should actually be approved for use in MSA patients. All of these project types are important to meet our overall goals of treating MSA symptoms, improving quality of life, or altering the course of the disease, and we hope one day leading to an effective treatment or cure. And now it's my pleasure to announce this year's selected research projects. Starting with the pathogenesis category, we're excited to share that the team of Hiroaki and Koga in Jacksonville, Florida, will receive funding for a unique study that focuses on high-resolution analysis of alpha-synuclein aggregates at the cellular level. This work is expected to lead to the discovery of new biomarkers and possibly new therapeutic targets for MSA. Moving on to biomarkers, this year we are funding 2 exciting projects. Drs. Kovacs and Lang in Toronto, Canada, will receive our support to develop a simple test to distinguish MSA from Parkinson's disease using skin and blood samples. And Dr. Leferrier and team in Bordeaux, France, will be working on a new method to detect alpha-synuclein in cerebral spinal fluid. Both of these biomarker projects fulfill a critical need to enable more recruitment of properly diagnosed patients for clinical trials. Preclinical studies in the lab using animal or cell models are a necessary step toward advancing to human clinical trials for MSA. So we are excited to support 2 new projects in this category. Professor Stefanova in Innsbruck, Austria, and Dr. Ho in Salt Lake City, Utah, are working together to test a new drug in experimental MSA mice that may improve cellular energy metabolism in brain cells. This drug is actually currently being evaluated as a treatment for ALS, multiple sclerosis, and Parkinson's disease. Positive results from this proof of concept study will support the advancement of the drug to a clinical trial in MSA patients. We look forward to seeing the results of this important preclinical study. Using MSA animal models, the Swiss-French collaboration of Drs. Courtine, Bessard, and Bloch will study whether an implant device delivering electrical stimulation to the spinal cord can automatically counteract episodes of orthostatic hypotension. If such a device could be perfected for MSA patients, it could have a significant impact on quality of life. This year, we are supporting 4 clinical projects directly impacting MSA patients. The Italian team of Aero and Pelleccia in Salerno will test transcranial direct current stimulation in MSA-C patients. The French team of Fabry and Samier-Foubert will develop a much-needed education program for MSA patients. We have renewed a 2nd year of funding for the abdominal binder study to relieve orthostatic hypotension in MSA patients, led by Professor Wenning in Innsbruck, Austria. Recruitment of patients for this study is ongoing. And finally, we are thrilled to announce the first ever study of pain in MSA patients. This project will be led by Dr. Fanchuli in Innsbruck, Austria, and will involve a global survey of MSA patients to better understand their experiences with pain. Stay connected with the MSA Coalition to learn more about how to participate in this upcoming survey. Congratulations to our newest research award grantees. The MSA Coalition has now awarded grants in 12 countries. And with the addition of these latest awards, we have now surpassed $3 million in grants and are proud to be the leading nonprofit funder of global MSA research. It's so important to stay connected with us, and I encourage each of you to subscribe to our newsletter, participate in online discussion groups, and contact us anytime through email or by calling our support line. All the ways to connect with us are listed at the bottom of our website, where you will also find more details about our funded research projects and the latest updates on new clinical trials in the MSA treatment pipeline. Just go to msacoalition.org to find us. We would not be able to continue to fund projects like these without the support of our incredible MSA community. Together, there is hope. Please spread the word to your family and friends about the MSA Coalition's research grant program. And please give generously during our year-end campaign, which kicks off on Giving Tuesday, November 29th. That's the first Tuesday after Thanksgiving. Thank you so much for joining the MSA Coalition at this year's Patient and Family Conference.